looking whether we have the right funding or no. Yeah? And then thirdly is digital health governance, especially when it comes to data and making sure that the data is secure, and finally having a human-centered health systems, which is training for the patients, making sure that they are aware of the tools that are being used, and also for the healthcare professionals. That is also really important. So in the final couple of slides, these are my final slides. I want to share with you a couple of examples where digital health was really used and how this helped in improving the healthcare of our patients. That was an example from Dubai Health Authority when they had a lot of people coming to do their fitness exams, to get their visas, and they have to do like thousands of chest x-rays, and they use artificial intelligence to try to figure out abnormalities in these x-rays and see who might be having a specific disease. And that was nicely adopted. And then they looked at the accuracy rate, close to 95%. Of course, faster approach, so you get to have much more capacity, and also improve patient satisfaction because it is faster. And this is one example, but then also if you look at, that could be applied everywhere. If you have a lot of people coming for investigations, you have capacity issues, sometimes also this is quite straightforward, but sometimes you do examination for some more serious disease, and you want to really know what are the more urgent cases. So these kind of technologies, they would help the doctors perhaps prioritize which patients to take first, and then the less urgent patients. This, another example is, this is one of the medications that we have at Merck. It's a growth hormone, and it is very nicely connected ecosystem where there is a device where the patient gets to get injected, and then all these data are transferred from the device to a web-based connection so that the doctor could see what is happening with the patient. And also there's one app where the patient could use, and all the history of the medication administration is being uploaded, and the patient gets to also upload the height status, what is happening, what is progress. So why is this important? Because it helps in decision making. So the doctor would know, okay, what is the percentage of adhering to the medication? If it's 80%, more than 80%, then perhaps this is okay. But if it's 50%, then the decision is not, I'm going to stop the medication because it's not working. No, I need to work on improving the adherence. So it gives this kind of insights to the HCP and making better decisions. And also looking at the aggregate data, you can figure out some patterns. So you know, okay, these are the kind of patients who are more likely to be less adherent. So you understand what is happening with these kind of patients. And then one final example that I would like to show you is one of the patient support programs that we also have for infertility patients, which is a connection, patient to the nurse, to the doctor. And here we're using some sort of a virtual nurse where the patient gets to ask questions and get answers from this virtual nurse. This is one example. I think the video should show now. I think the voice is not the voice is not working, but it's okay. I'm gonna explain it. So the idea here is that this is a virtual patient support program, and then we have this virtual nurse and then we feed in the nurse with the expected questions. And as we build on getting more patients, we have more database of questions and perhaps have much more accurate responses. This is only one feature that I wanted to share with you so that you could also see the future of healthcare. So these are some couple of examples of using digital innovation in healthcare. So with this, I would like to conclude my presentation. So the future healthcare is moving towards prevention. And this is capitalizing on a more empowered patient and caregiver. Number two is we have limitless opportunities from leveraging data in healthcare. Number three is data privacy is still a challenge that needs to be addressed to make sure that we use data in the right way. And finally, digital innovation in healthcare can have a lot of very nice applications that would definitely lead to better healthcare. And with this, I would like to thank you very much for your attention. Thank you.